Okay. Which of the following is the most likely cause of this child's presentation? A 15-month-old boy is brought to the pediatrician by his mother due to concerns about his growth and development. She reports that he has been unable to gain weight despite eating small amounts frequently. His appetite has decreased over the past few months. On examination, the child appears emaciated with thin extremities, sparse hair, and loose, wrinkled skin. He is alert and active but has a weak cry. Laboratory results show low serum albumin and decreased prealbumin levels. What of the following is the most likely um, cause of this child's presentation? Uh, okay, so I do think when I see the words emaciated, low serum albumin, I think of a kwashiorkor, I think is what it is. I think of that disease, but I feel like he's been trying to eat a lot. My immediate gut is just inadequate caloric intake.
Okay.
Um, I don't see any proof here of celiac disease. Congenital hypothyroidism would show like protruded tongue and like I forget the exact name of the disease is what it's called, but like protruded tongue, like pot belly,
Mm-hmm.
like
Cretinism, right?
cretinism. Yes, I don't think it's cretinism. Pyloric stenosis would show up with like a knot in the stomach. Everything they call like a I mean, they would say something like, "Oh, on palpation of the stomach, they feel this knot or they feel this little like ball." So I wouldn't say that. And vitamin D deficiency. Ooh, wait, let me think about that. That could be it's rickets. Loose skin, sparse hair, wrinkled skin, a weak cry, low serum albumin, decreased prealbumin. Oh man, they don't talk about any type of bowing of the legs. I'm gonna be so upset if it's vitamin D, but I'm gonna stick with an inadequate caloric intake.
Yeah, this is going to be your best answer, right? The reason why it's going to be your best answer is because they tell you like decrease albumin, sparse hair, loose wrinkles, right? Things like that, right? Only eating small amounts, right? And so you got to be wondering, is the kid eating enough? So,
Mhm.
right. And they say, due to concerns about his growth and development, right? Unable to gain weight. That should be one of your main things, right?
Yeah,
Kid who's
yeah.
not gaining weight is such a huge thing. So just not eating enough. And so remember rickets, right? Soft, weak bones, but does not cause severe malnutrition and low serum albumin, right? Which is a protein, right? Or pre-albumin levels, right? Which is just think about pre-albumin, albumin are good indicators of good nutrition. And we actually use that for our head and neck cancer patients too. You want their albumin to be high enough, their caloric intake to be high enough and not cachectic enough, because it increases. If you have good nutritional status, then you're going to have better prognosis dealing with your cancer or surgery and things like that. So just kind of think of albumin and pre-albumin as indicators of nutrition.
Cool.